First, I would like to ask for your permission to use this interview and your record and information for educational purpose and on internet. Do I have your both permissions?
Yes.
Yeah.
Excellent. Now, tell me, you just told me about your symptoms. Would you mind to repeat them, or you can help as well? Tell me about what are the symptoms. What do you feel? Where is your pain? How long has it been going on?
Down the front of my legs
Mm-hmm.
and down to my feet
Okay.
and my lower back.
And you said you have pain, 1 to 10, how bad?
That's a 10
Every day?
every day.
And you said your walking is very limited. How far
Yeah.
can you walk?
From here to that door.
So that's practically, what would you
About
say, 6 feet? 6 feet. And this has been going on for a long time, right?
Yes.
So,
About 3 or 4 years.
and you did physical therapy, and you said, what did the physical therapy do for you?
Nothing.
And you said actually it made it worse to me.
Well, they tried to put me on a treadmill,
Mm-hmm.
and well, I couldn't walk,
Mm-hmm.
so that wasn't working.
Okay.
But I can sit down for
So you're practically not really freely, you cannot freely ambulate.
no
And how long has this been going on?
since my heart surgery. That was in 2010.
2010. Okay. So that's going on for a few years now.
Yes.
For many studies show us that if somebody doesn't ambulate, it's actually your body shuts down. Our body needs for us to walk, and those studies are very clear.
Right.
So you not walking, this is not a trivial situation.
No.
Your pain being 10 of 10 every day, that's not a trivial situation.
No.
So, but you looked for surgical solution, because I'm going to swing here. You have scoliosis, you have severe stenosis, and your spine is literally falling apart. And tell me, what was your experience? What did other surgeons tell you what they want to do for you? Without telling names or places, just it's about education.
We went to see a doctor in Sioux Falls, and
He said it was so severe that he didn't think that he could possibly go through the surgeries, because they would have to have 2 surgeries at like 6 months apart. The first one they would do, and then he would have to heal up and then come back and do a second one.
Okay.
And each one would take anywhere from 6 to 8 hours.
And 2 surgeons would be doing that, he said. He told me.
2 different surgeries.
Yeah,
Yes.
but 1 surgeon or 2 surgeons?
Well, we don't.
the same surgeon.
Okay, I see. Now,
Yes.
and did he tell you, all the risk and so on associated with going first from the front
Yes.
and then going from the back? Did he talk to you about that?
No.
Just the front. He would have to go through the front, and
Sure.
of course with him having.
Well, going from the front requires a general surgeon or vascular surgeon to open you. That's
Yes.
always a 2-surgeon solution.
Okay.
Okay.
And as well, this is a scoliosis surgery, so he's being very realistic that this is at least 8-hour surgery, 2 surgeons working on you,
Yes.
and twice that makes 16-hour surgery. Now, and you have some other unfortunately medical problem, so the risks are up to roof. Any surgery that's more than 3 hours, we know the risk go exponentially higher. Like if the risk of the surgery is that much, if the surgery is more than 3 hours, is not twice as much, it's about 3-4 times as much.
Yeah, that's what he.
Yes.
That's why he didn't really encourage him to do that because
Yeah.
of his age.
But
of the timing and all that.
But
so.
being in pain 10 of 10 and not
Oh,
being
yeah.
able to walk is not a solution either.
All they want to do is give you pain pills.
Yeah, and that
And
people
those
get
don't work.
knocked, people get, dependent on the
Yes.
narcotic now.
I
I think
wound up in a hospital for a week.
after
and
being
taking
overdosed.
pain pills. Yes.
Okay, yeah, here you are, and that's a dangerous situation by
Yes, it
itself.
was. Yes,
People
it was.
die these days because of that. Now, I
Yes.
think in the inspired spine, the solution we have is we made a 16-hour surgery to a 1.5-hour surgery. We made a surgery that you lose your entire blood. In like a scoliosis cases, you can easily lose your entire blood and we have to replace it. We made it a blood loss of 100 cc, which is a half a cup or less.
Yeah.
So I think that's why OLLIF is an option for you, even with your situation, even with this finding.
That'd be
Whereas,
awesome.
the open surgery truly is not an option for you.
Yeah.
So I think I can help you, but again, that's what I tell to everybody. The Lord didn't send you down with a guarantee and a handbook, and they don't have that. But our result has been impressive. We have a significant amount of patient testimonial, people who have been literally hooked on narcotic and have been even suicidal because of the pain. We have been able to help lots of people. Our result has been published. It's all there for everybody to review. And I think we pride ourselves that we can help people who are really in a bad situation and a desperate situation who nobody else wants to help. And so I'm happy to put all my expertise on you to help you.
Oh,
Okay?
that's great.
Thank you.
You're welcome, and thank you for the interview.